While suggestion boxes exist in some areas, there is no structured process for collecting, recording, analyzing, and responding to complaints in the systematic manner. As a result, complaints are handled informally at the departmental level without proper documentation and follow-up.
Thank you, Honorable Chair. I'm going to ask our Principal Hospital Admin to respond to that.
Thank you, Chair and honorable members. Yes, as observed by the Auditor General, especially in regard to the issue of the complaints register, we've taken it up. We had it segmented, but as they have observed, now we have a centralized complaints register right at the gate of the hospital to make it easier even for other people who may not want to come to the hospital if they have any issues to report, to do so. And we want to popularize this to make people aware of it so that we can also get complaints through the call system and register them. Not only register them, but we have a system of follow-up to ensure that whatever complaints come through, they are handled to the satisfaction of the client and the feedback is given, especially if they provide their telephone contact. Thank you, Chair.
Yeah, honorable colleagues, this is noted and this is to your benefit. Yeah, much as the patients benefit out of it, but it is more beneficial to the hospital than the people that you do serve, in line of provision of an excellent services to your customers. Then the high bed occupancy rate of 160%. The auditor takes note that there is a shortage. I start from where Butabika Hospital has an installed bed capacity of 550 beds. However, a review of the inpatient statistics showed that the facility is currently accommodating more than 1,200 patients at any time given, resulting into a bed occupancy rate of 160%. This means the hospital is hosting more than twice the number of patients it was designed to accommodate. Management also reported that the bed occupancy has risen further to approximately 230% in the financial 25-26. Yet no infrastructure funding was provided to expand inpatient capacity during the year. Where do you keep these patients? From a bed capacity of 550, then to 1,200. How do you do this? Because the people need to benchmark from you. Hey, you can improvise up to this extent.
Honorable Chair, it's difficult to say the least, and but we try as much as possible to provide care to whoever comes, because like you mentioned, Honorable Chair, it's very difficult to transport our patients. So if someone turns up in ropes, you cannot tell them, go back, we don't have a bed, because they have nowhere to go back to. So we try to accommodate them so that we, ensure that everybody gets at least some care before they go. But it is very complicated. However, we have planned to decongest the hospital, and the recommendation from Auditor General was that we develop a clear and time-bound strategy of addressing the current congestion. We have analyzed the issues and what we think we need to do. We have just a brief analysis of what we are doing, and we hope that over the next 3 years we should reduce our numbers, hopefully, to 650 only. We wish to expand the infrastructure.
You can briefly speak to this in just a minute, for people to, at least to give hope to the country. Just in brief, you can.
Additional copies. Yeah.
Additional copies, please. He's going to pick them. No, there is somebody from this side. So, sir, speak to your intervention in ensuring that we decongest Butabika.
Yeah, we are hoping that our goal is to, in 3 years' time, reduce from 1,200 to 1,400 to about half, at least 650, by doing certain things. Some of these things are technical. Hopefully by increasing essential mental health medicines continually training primary healthcare workers in mental health at health center level so that they can take on some of the load. We are also, this one shows an analysis of what the problems are, why we have a high inflow and a low outflow. I'll not talk about the details.
we shall read through, but
so.
we have already given the solutions. Involve leaders. You know, single families have contributed to mental illness. You hear people feeling proud of single mothers, but you know what they go through. It's not easy. So what has Butavika done to reduce that? Marriage breakups. Those are the things. So there is a lot that we can do with the community using leaders. So let's also look out for those non-economic. You will not pay an MP to go to do that service. I've told you about those youth councillors down there. Those ones, they can do you some good work in ensuring that they reduce the marriage breakdown. Those things. So,
Honorable Chair, that is very innovative, and we will take that idea to add to the plans we have here to expand space, scale up support supervision in the regions, increase the number of community outreaches, improve mental health awareness in the community. That is a big one that we hope we shall do. And providing essential medicines is also a big one because it keeps people in the community when they have medicine there rather than bring them up. Now, we shall add, thanks for the idea, to involve local leaders.
Involve leaders. Honorable colleagues, as we do proceed, you know, we have Chirudu National Referral Hospital at midday. For these others, implementation and functionality of you called it the AFIA system.
Yes.
It's not yet operational, and unallocated funds in this. It's operational.
Yes.
Okay, we take note. This management of non-current assets, that is consequential. We've been looking at it in most of the entities. The incomplete asset register. What's the problem?
Thank you, Honorable Chair. We've been updating our asset register the whole of last financial year, but I'll ask Principal Accountant to speak to this.
Thank you, Chair. Chair and members, the issue of updating the assets register is an ongoing exercise because the assets module is being implemented by Ministry of Finance, and we are looking at the information we have, and we keep on updating the assets we have so that the assets register matches with our financial information.
Of the asset register, please do update your register. That is in your interest. We go to 2.14, overutilization of equipment. Honorable colleagues, let's proceed. We move to 2.14, overutilization of equipment. The author noted that according to the interviews with the management, each monitor designed to handle a maximum of 100 patients would handle 300 patients per day. So this brings us back to inadequate equipment. All speaks the same. But what is the impact of this? A machine that is supposed to handle 100 patients a day, it handles 300. Does this compromise on the results given?
It may cause equipment breakdown very quickly. So we need to add to the equipment. Of course, it compromises on the function of the equipment, for sure.
So let's take note of that. Inadequate budgets for maintenance. Yeah. We take note, but we come to the staffing gaps. That is 2.15. Out of 836 approved positions, you only have 396, a staffing capacity of 47%. So you have 440 vacancies. In addition, the author noted that 12 staff members were occupying positions not provided for in the structure, indicating an overestablishment in certain departments. Specifically, excess staff were observed in divisions such as nursing, outpatient services, pathology and clinical laboratories, pharmacy planning and financial management, procurement. These included roles such as assistant and anesthesia officer. Tell us about, yes, you talked about the understaffing that has been noted, but why do we have staff recruited outside the structure?
This has been improved. Some staff titles were not as they currently are, the ones that our staff had, but we've done some work around this. I'll ask HR to please step in.
Thank you, Chair and honorable members. Apparently, this is not an overfill. These are not overfilled positions, but these were positions on the structure. But you know, we got a new structure in 2024, but it had left out some titles of people. But these people are in position, and as you may look at the response, we've communicated with the Minister of Public Service, and these positions have been captured on the HCM, which is the Human Capital Management System, and it's not an issue of being overfilled.
Also, Honorable Chair, some of the positions, the titles were not correct. The appointment letters that had been given previously did not speak to what the current titles are. They appeared like they were overfilled. So we have done a redesignation of many of these.
Okay.
So there's no overfilling.
Management of essential drugs. The auditor notes that there is inadequate supply of medicines and sundries by national medical stores. That was noted before. The hospital had a credit line with NMS of 3.5 billion for the year 24-25. The auditor noted the following: under absorption of the available credit line. A review of the procurement plan for medicines and other health supplies revealed that the hospital had a credit line of 3.5 billion for the year 24-25. The bimonthly delivery schedule was valued at 583 billion. However, the auditor noted that during the year, NMS supplied medicines and sundries worth 2.23 billion, representing a 63.7% of the planned deliveries. This resulted in a shortfall of 1.2. You don't have capacity to utilize the budget given.
Honorable Chair, that is not true. We use the budget and even use more than we are given. But at the time of the audit, the reconciliation was still happening. It has since been done, and there's an appendix 12 for you to look at. But I'll ask the principal pharmacist to please throw some light.
So, but as it comes in, did we consume all the 3.55 billion for the drugs?
More than that.
More than that?
Yes.
Please.
Thank you, Chair. As communicated earlier, the budget was fully utilized, and we even had we got 105% utilization. At the time of the audit, there are some medicines which national medical stores, especially super specialized reagents, that were delivered to the hospital, where we only receive delivery notes from suppliers. They call it cross-docking. And then the invoices are then processed by national medical stores. So those invoices had not been delivered to us, but in our attachment they have been provided. And the reconciliation was fully done. Going forward, the audit advised us to do reconciliation frequently. We now do quarterly reconciliation, and we have also revised our delivery schedule from 2 months to a monthly supply, so that we can be able to effectively monitor the budget and also follow the supplies. Thank you very much.
Accounting officer, you are aware of the public outcry when it comes to medicines in hospitals in a general way. And when it comes to, you've just spoken to the issue of absorption of the 3.5, but we also take note of the delays in deliveries. There are also undelivered supplies under here. The author noted that there were drugs that were not supplied. In addition, 126 items worth 673 billion in the procurement plan were not delivered during the financial year, while 20 items worth 32 million were supplied against this, representing 14% planned quantities. So we take note of the inconsistencies and the challenges in delivery of drugs, but this is public information. People come to hospitals, they don't get drugs. And whenever you see a delay in delivery, that means some of your patients have been denied a service, and you know what it means. This delay of 22 days, delay of 69 days, delay of 20 days, this means automatically one will come for a drug, it's not available. One will say this will serve the next batch, but that's not the way you plan. The reason as to why you plan for these quantities in a specified period of time is because that's how you would wish to serve your people. So the fact that you are handling a very critical area, health is not it's something a little unique. A service that once needed, it is time bound. And these drugs are expensive for the wananchi omuntu wa wansi. So kindly make sure that you do streamline on some of these deliveries. When it comes to maintenance, we can do better. For these other areas, we shall take you by your response. This implementation of the NDP3, for this we shall take you by your response. We just wanted to go direct to your mandate and see how best Butabika serves its people. However, we need an answer on how much did you get from NTR when it came to the charges on interns. We want to see whether we cannot forego that. How much did you get from your NTR in regard to collections from internship? You said you would get that figure.
Madam Chair.
Yes, Honorable Mudimi.
I want to draw attention to page 9 of the accounts. Liabilities of 13 million. Page 9, 13 million. Then on the page 30, payables. Page 9 and page 30, you read both of them concurrently. Page 30.
Madam Chair, Honorable Mudimi, you would take it up to 40, 43 at once. That is one line.
I want to be educated on note 28. Note 28.
Honorable Chair, I'll ask PA to respond.
Thank you, Chair and the honorable members. On page 9, we have 13.1 for payables. This is money which remained outstanding at the close of the financial year in respect of cleaning services that were not paid. So when we go to page 30, we are trying to classify them further in the form of current and non-current. So this one is for the year, the 13.1. That's how we have picked it, whereas 40 has been on it was carried forward. That's why we are calling it non-current.
Chair, I think the issue is not the figures stated. The issue is that 13.1 was an unauthorized payment. It falls under goods and services. When you look at your appropriation account, the money that you are given for goods and services is actually less than what you spent in your financial statement of financial performance. And that's the difference of 13,000. So meaning that what you call cleaning services, you had been given money for cleaning services, but you went ahead and acquired more services which were not budgeted for. Well, if they were budgeted for, you mischarged money meant for cleaning service and used it for something else, and that's why you have this one as an outstanding payment of 13.1. So the question is, how did you make a payment which was not authorized? Because the authority should be through the appropriation account and by Parliament.
Chair and members, we didn't make any payment that was not authorized. It means we consumed the service, but the money was not enough because of budget inadequacies.
Yeah. Just when you look at the statement of appropriation, you didn't budget for any areas. But now what Honorable Taiba was saying is you committed the government into these areas despite the fact that you did not even budget for what was there before. You look at your statement of appropriation, page 12. You didn't budget for.
It is true, Chair, that when you look at our statement of appropriation, this money was, the budget is less than what we consumed. So the other side, we have 6.923 billion. We had to include it in our statement of financial performance because it forms part of those expenses that we incurred or that were rendered during the financial year.
Maybe we can help you just very, very quickly. What Honorable Herbert and the colleague are saying is that you actually spent without authorization. Not that you spent money, but you committed what? Government. Over and above what had been warranted to you. And when you are raising invoices, when you are spending, you don't spend according to the budget, but you spend according to the warrants, and therefore funds release it. Yes, you had the budget, okay, but the funds were not enough, so you spend according to the warrant. That's what they were telling you. So when you respond and say, no, we did not spend without approval, without authority, you will see the colleagues keeping quiet because they will say, now what is he saying? Because you should be spending according to warrants. Okay? I hope you've got it.
I've got it. I agree with you, Honorable Member. Thank you.
Okay, honorable colleagues, as we do conclude with the Butavika National Referral Hospital, you said, we take note of the services that you do offer in the line of mental health, but only to update you that the mental cases are increasing instead. So what does that imply? There is a lot of homework for you. These figures of 24.2% in the adults and 22.9% in children is very overwhelming. It is still on the upper side. We do take note of the challenges in our staffing capacity, the bed capacity, a provision of essential drugs, And we also take note of the inadequate budgeting. But as we've discussed, we need to consider having a complete cycle, the supervision of the referral hospitals, having a mechanism of getting feedback. You've seen it's a query in your report, how to respond to the cases and for how to make a follow-up on those that you have discharged. We need to have the cycle complete. Otherwise, we want to thank you and your team for the duty of service to the country, and we just implore you to continuously improve. We understand there are some of these other challenges, but we also look at these internal administrative challenges that can be handled by you as the head of the institution. Also, take note, you have something that has not been concluded, the failure to quantify the 36 outputs, the activities that were not quantified. And that was to a tune of close to 43 point something billion. Then I'm a bit disappointed as to why you have failed to communicate on how much you had as NTR when it comes to payment of intern fees. You know, the reason as to why I wanted that figure, you would find that it is very minimal. You are also parents. Anything that adds a cost to any service rendered to you, automatically it contributes to your overall expenditure for the year, the budget. So sciences are very expensive, education is expensive, don't make it more expensive. By you saying that for the intern students, you give them a free service, and for the private ones, you have to charge because the schools do charge. Government can stop the schools from charging because at the end of the day, those are also Ugandans. So, Madam Accounting Officer, try to make a follow-up on that matter. Why should interns pay money? You don't have staff. These students come and work for you much as you train them, but they also give you a service. However little the fee can be, but it's an additional cost to the cost of education in this country. I want to thank you, but just know you have to provide that figure. By tomorrow, kindly send somebody with the details of how much you get as a collection under NTR, the non-tax revenue from the intern students.
We'll get that.
Please. And as a girl child, we implore you to keep that space for Amero's children. You know, whenever you occupy a space as a woman and you use it well, that is a plus to us as women. Women are never thieves. Women are never corrupt. It is only other creature, but not a woman. So, yeah, no, I said the other creature. I don't know which creature is that, but for me, I said the others, but not women. So, so as we do occupy these spaces as women, No, I'm not Sikuba, but you know the strength of a woman. Whenever a woman occupies a space, so we are not disadvantaging a boy child, but that is for a woman. Please make sure we use those spaces so that a girl child is, Otherwise, we want to thank you for this engagement. We pray that you continuously improve. We don't want to see these same queries in the next Auditor General's report, except those areas which is those that are out of your control. We normally provide lunch to our guests, but currently our budget line for welfare has seriously deteriorated. So I would encourage you to smartly move back to Kutabika and find the patients. Thank you. Honorable members, we are going to have a break of 30 minutes. Let's have lunch for 30 minutes. Let's come back and handle Chirudu. We have 2 entities, Chirudu and the East African Community Ministry. Chirudu is already here, some 30 minutes for you to have lunch. Max, you see how to handle Chirudu to have lunch. Then we come back at the same time. 30 minutes, please break as we have lunch. Honorable Mudimi should see if Zangura had given, please do.
You're crossing to Madness by the time you ask.
How can you refer us to